Welcome to Local Business Spotlight. Everyone in the studio with me today is T1 Health and Wellness, and we're having a conversation that a lot of men don't like to have. Let me introduce you to, yet again, Dr. Keith Nicholson. How are you, my friend?
How about yourself?
I am fantastic. All right, we ready to touch on the topic?
We are.
And we are talking all about men's erectile dysfunction. Now, we're going to call it ED, just for everyone at home. What is ED?
ED is the inability to attain or maintain male performance.
Okay, how common is this in men, and where are we looking at on the age spectrum?
Well, about 30 million men in the United States have ED, 150 million men worldwide. 80% of that goes unreported. Mild to moderate ED affects approximately 10% of men per decade of age, so 50% of men age 50 will experience some form of ED.
Okay, what about the younger age bracket? Because I know that's possible as well.
It is, 30% of men age 30.
How do we get ED to begin with? What's going on in our man's body that this is an issue?
Well, there are a lot of risk factors, but there's 5 main categories of causes. One is pharmacologic, so medication side effects such as antidepressants or antihypertensives. Then you've got endocrinologic, which are hormone deficiencies, testosterone, for instance. Then you'll have neurogenic, Parkinson's disease, Alzheimer's, diabetes.
Yes.
Then vasculogenic, which causes 80% of ED, hypertension, cardiovascular disease, dyslipidemia. Really? And then psychogenic, which is stress, depression, and anxiety.
Yeah. Lifestyle.
Of course.
It's all about the lifestyle.
Yeah, sure. It's interesting to say that obesity, smoking, excessive alcohol use, a sedentary lifestyle all increase the risk of ED.
I got you. All right. I'm sure everyone at home would like to understand what are some of the things that we can do to help our ED?
Well, first and foremost, diet and exercise.
Yeah.
Okay.
Of course.
And then that hopefully that'll improve a
great deal.
Diet and
exercise makes you feel good no matter you're man or woman.
Of course it does. Of course it does. But there's several treatments available to people that we can utilize. One being hormone replacement, which of course testosterone is vital.
Yes.
Then we can use vacuum devices. We have PDE5 inhibitors, the Cialis, Levitra, Viagra.
Right. Okay.
Then we have what we call the P-shot, as well as sonic gains.
Well, I want to just talk to you about the P-shot because there has been a lot of conversation on that, and I've interviewed doctors before who are doing the P-shot, and they're getting incredible results. Explain the process and what's actually happening.
Well, the P-shot is the utilization of platelet-rich plasma to improve the symptoms of ED. We use an advanced form of PRP known as LPCGF, which is liquid phase concentrated growth factors.
Right.
So platelets contain growth factors, and when extracted, concentrated, then re-injected in the body, they stimulate tissue regeneration, they repair damaged tissue, and they generate the formation of new blood vessels.
Okay, so this is a non-surgical procedure.
Yes, it is.
It is a little invasive, but non-surgical.
Yes, painless.
Okay, you said there was another one as well.
There is. It's sonic gains.
What's sonic gains?
That is low-intensity extracorporeal shockwave therapy, which is the utilization of high-frequency, low-intensity sound waves to open up existing blood vessels, as well as to stimulate tissue regeneration and the formation of new blood vessels.
Okay, how often would one be needing both of those services?
It depends on the degree of ED.
Okay, so is there an age that we can have a P-shot or sonic?
Any age.
Really? Any age?
Any age.
Okay, what are you seeing out there in the marketplace in regards to that?
I'm surprised, but we're seeing men in their late 20s, early 30s, on up to, of course, 60s and 70s. As age is a risk factor for ED, but what's surprising is the number of young men experiencing ED.
Doctor, will you come back and talk more about
certainly
this?
Will.
I think it's a really important conversation. We appreciate you.
Thank you.
Thanks for coming in and having a conversation about things that men don't really like to talk about. We appreciate it. If you want to find out more information about T1 Health and Wellness, there it all is up on the screen. Give Dr. Keith a call. It is confidential. He is an expert in this field.